Ilaria Capua is, hello, good afternoon. And I am so happy, honestly, and I've been impressed with your work for a long time because you've been a politician. You are somebody that's been on the forefront of studying viruses for a long time and pandemic. You've been an advocate for data sharing, and by training, you're a veterinarian. We're so lucky to have you here in Florida, and you're leading the One Health Center. And now you can talk to us actually more about the One Health Center. If my understanding, One Health Center is about the health of the environment, the animals, and human. In this moment where there's this global pandemic, COVID-19, what you're doing, where is your focus right now?
Thank you, Rula. Thank you for having me. And thank you for having time for science. It's important that people like you start creating a new way to engage with scientists and to transmit what we try to do to the general public. So thank you. I direct the One Health Center of Excellence at the University of Florida. And the mission of the center is to co-advance the health of humans, animals, plants, and the environment. Because for too long, we have advanced only one of the pillars of health, and we have disregarded others. And so now we have immense potential and resources that can be funneled to exploiting the big data environment to really get the bigger picture, because we are all interconnected, and COVID-19 is showing this so clearly.
So let's talk about COVID-19 directly, because people are dying in hundreds of thousands of people are dying in Italy, in the United States. I mean, we saw the image of New York City digging mass graves. It's something we never thought would ever happen. However, we are here. Can you please tackle, how did it start? Was it preventable? Was it predictable? And you know, there's all these conspiracy theories about that. It's a weapon. It was used as a weapon. Can you please lead the people? You are one of the few people who is always have, her approach is scientist-based, scientific approach. Can you please tell us, how did this started and was it preventable?
Okay, so to do this, I will ask you to come with me and sit on a star and look at planet Earth from a star. And let's pretend that we are 10,000 years ago. And 10,000 years ago, humans, Homo sapiens, domesticated cattle. And when they domesticated cattle, they came in contact with cattle milk, cattle meat, and cattle products. And the virus, which was endemic in cattle, which is known as rinderpest, started infecting people and became measles. So basically, we have had spillover effects from the animal population to the human population, with a subsequent endemic transformation of the virus, because measles is now a virus of humans. So if you come with me on the star and let's look at Wuhan, right? We zoom into Wuhan. Actually, we zoom a little bit further out, and we zoom in a jungle where there's a bat that is sitting by himself, having his own life. And this bat gets captured and brought into a live animal market and is put in a cage with other animals. And it's really stressful for the animals. The animals, they're afraid. They can't take care of themselves. They urinate, they defecate, they are full of fear. They are mixed in the same cages because in some parts of the world, they want to take live animals home because they butcher them at home. And so in this
a feast for a virus to be in that environment. Live cattle markets are a feast for viruses.
Yes, they are the perfect place where nature can actually pull out its bioterroristic nature, because those two viruses that created SARS-CoV-2 should have not ever gotten together. But they did, and here is the next step. They did, and they started infecting some people in China who are people who are poor and live or work around that market. And these people don't have any medical assistance. And so what happens is that they go to see the doctor after a while, and the doctor says, oh, come on, you can't pay for it. Go home, you'll have the flu. And so basically the spiral of transmission started, and it was the middle of December. You get a respiratory form in a group of people in the middle of December. What is it? You think it's flu. But it wasn't flu. And by the time they understood it wasn't flu, and we're into the middle of January, but basically the virus had already become widespread, and we put it on planes with passengers which were infected and had come from that part of the world, and we spread it to the whole globe. So, you know, you mentioned conspiracy theories. This is not a virus that was made in a lab. This is a virus that was generated by Mother Nature. But certainly, had we left it to behave like rinderpest, it would have taken the virus centuries to go around the world. Spanish influenza took a couple of years to go around the world. Why? Because it was traveling by boat and was traveling, there was the war. This virus is a virus that maybe could have gotten extinct if it hadn't occurred in the middle of a 10 million, 11 million people megacity. And so is it a pandemic of our own creation? We have created all the conditions for this infection to become a pandemic.
So when people, populists who are nationalists, they blame China and say maybe it's a biological weapon, that's not accurate. But China somehow did not warn the world, or let's put it this way, they downplayed it, or they didn't communicate the numbers accurately. Can we say that?
I really don't think so. I think that we should respect the Chinese authorities who were on the forefront of this. We are talking about having to identify a virus which was unknown. And so just to give you an idea, okay, in Italy, the first person who was admitted into hospital with COVID-19 was sent back home because everybody thought he had the flu. So, you know, it's very easy to criticize and to say things weren't done well in hindsight. I have to say that the lockdown that was put in by the Chinese authority basically allowed the rest of the world to prepare.
Ilaria, one question. You talked about viruses jumping from animals to human. We saw that COVID-19 actually, there was a tiger in a zoo that was infected. We saw that some chickens were infected. Are we seeing the jump of this virus to animals, chickens, cattle, and they might jump back to humans? Are we seeing this transfer? And what would that mean?
Well, yeah, this is a very clever question. Actually, this risk exists. There have been cats that have been shown to be infected, and the big cats in the zoo. There are farm animals that have similar receptors. And so is it possible that COVID-19 spills into an animal population? I think it's possible. It comes from animals. And so it's actually more adapted to animals than to people. And so is this possible? Yes. I certainly think that we need to prepare, because obviously this is a disease that is particularly dangerous with elderly people, and elderly people often have pets. And so we're going to have to think about how we are going to manage this problem. And this is where public health becomes One Health, because obviously we are trying to protect public health through the application of measures that concern animal health.
So when some governments who reacted to the virus by locking down, and months later we're seeing that in certain areas, South Korea, we're seeing in New Zealand, Belgium, Germany, in certain areas, it seems to have worked out. So the numbers of death is lower than other cases. However, they cannot lock people down forever. There's also the economic health of a nation. So what is the best approach to start going back to work? Clearly, a lot of these countries are looking at science to guide them. What would you advise the Prime Minister or President? How can they approach the opening or reopening of the economy? And you talked more than once about women being more resilient to this virus. Can you please discuss that?
Yes, so I agree with you in that health comes first, but obviously you cannot have health if you don't have a healthy country. And so I think that there are certain things that we know, and we know that some populations are fragile, and these populations are going to have to be protected until the virus is either so widespread that there is a condition of herd immunity that keeps them protected, or until we have the vaccine. So there are other categories of people who have shown to be less susceptible to the severe clinical form, because actually what we have to be worried about is the severe clinical form, because that is the form that can lead to death. And so when we look at repopulation, we have to start from the hospitals. And this is what is being done in Italy. In Italy, as soon as the hospitals start working again with a normal burden, then at that point, reopening can start. And we can start reopening, I think, on the basis of what are the country's needs, but also on the basis of a certain health status. And all the data of the world show that women have a risk which is the same or lesser than men than dying. And I think that this is something that we need to bear in mind, because we should at least look into a repopulation which is gender equal.
It's incredible we're talking about specifically that point. One of the best countries that were handling this crisis is actually led by women. And I'm not being biased, but it's a fact. These are the facts. So you talked about the vaccine. We know that the vaccine, we will have a vaccine in 1 year, maybe somehow, around 1 year. And so do you think countries are more invested in finding cure? There's a rush to finding the cure, and they talk about a lot of medications, we will discuss some, or they need to focus more on a vaccine?
Well, we need to focus on both, because actually, let's not forget that we've known this virus for 4 months. And so how can you make any judgment on how he's So if you get a new boss, actually, we all have a new boss who is this virus, who's turned our life upside down, and we've only known him for 4 months. You don't really trust someone you haven't known for that long. And so I think that both the vaccine and let's say the therapeutic should be investigated. And with artificial intelligence, this process, I think, will occur in a very speedy way compared to where we were before.
Do you know of any medication that is working currently to defeat COVID-19? Do you know any effective medication so far? I mean, we have the President of the United States talking about anti-malaria medication, other people talking about anti-parasites. Is there a medication available today that has the highest level of success when it comes to tackling COVID-19?
So I don't think we have any certainties, but we do have one certainty, is that hospitals need oxygen. Houses need oxygen. And so oxygen needs to be available, because with the severe respiratory distress that this virus is causing, people need to have oxygen when their respiratory condition degenerates.
Ilaria, one thing, when we look at the characteristic of this virus, and you've been studying viruses for a long time, is this virus mutating? And did we see a mutation in these 4 months of this virus? And once we tackle COVID-19, is there a risk that it will be COVID-20, 21? I mean, what are we looking at here?
We are looking at a virus that, as it multiplies, it evolves. And viruses evolve mutating, but mutation does not mean it's going to get worse. It means it's going to get different. And actually, a lot of mutations attenuate viruses. So we just have to wait and see how it behaves. But I think that one thing we have learned from this virus has given a breath of oxygen to our world.
Planet.
Yes, to the planet. Exactly like COVID-19 patients need oxygen, this virus has forced us to look at the miracle of nature that is coming back and that is resilient. And this is one of the great positive ramifications of this tragedy.
Ilaria, I noticed, and it's not a scientific observation, but most of the cities that were hit were highly contaminated, highly polluted, highly dirty, with a huge mass population and very effective transportation system. Wuhan, New York, Milan. Am I wrong that there's a correlation? Is there a correlation? This is my question.
Actually, there was a paper that just came out a few days ago from Harvard exactly on this. And of course, I mean, if you live in an area in which there is bad air, your lungs are going to be suffering more. And so it is likely we are, though, going to have to figure out what is it that contributes to that bad air that actually can be solved, right? Where can we intervene? This health emergency is highlighting that we have so many opportunities to have an excuse to do a better job.
So, I mean, I've been your admirer for a long time, way before we met, since you were a politician in Italy. And I also remember there's a moment in the world, not only in Italy, in the United States, of mocking, dismissing experts. Moments where we were people who are experts, who are specialized, were demonized, were basically never taken seriously for years. Do you think that changed? Did the virus impose on all of us more consideration, more respect for the experts, for scientists, virologists, immunologists, doctors, nurses, this category?
Yes, this is a very ugly moment for scientists, because I think that the divide that there is between scientists and society has now become unsustainable. And that is why, as experts, we have been criticized. But I think that COVID, once again, as a minuscule ball of jelly, has shown that it can be a major game changer. And I think that this is what it can do. And we are talking, so we had never met. We are now talking, and the first thing I said is that this is really good because we're talking about science. And so I hope that through people like you, we can reconnect stakeholders, citizens, to the beauty of science.
So there's no doubt the people who wanted no vax advocates, they wanted a world without without vaccines. This is a world without one vaccine. Their silence is deafening. Let's put it this way. But as a solution to COVID-19, to this pandemic, I mean, we have to look more and more to science. Science can save lives and can save our planet, can save our lives. And in this case, if you were to advise governments or entities or the G7 or the European Parliament, where would you invest money and resources nowadays? What is the priority number one for you, number two, and number three?
Well, actually, sustainable globalization. We have seen that globalization is a great resource, but causes disasters in terms of inequality, in terms of labor exploitation, in terms of pollution. And I think that although we cannot renounce some of the peculiarities of the production world that obviously are extremely important, we have to find a way to not destroy the aquarium that we live in, because if we destroy that, there won't be any space for anyone. And certainly this pandemic has shown us that we can achieve so much remotely. We don't need, I mean, let's say that traveling for business is going to diminish. Because you're actually much more productive if you don't travel as much. And so I think that it will also give us some insight on how to lead, a more sustainable life. We don't have to run all the time and burn resources. So that's the direction we should go in. And of course, unleashing the power that is, and the talent that is in women is also one of the transformations that I think this pandemic can bring. And so I am hopeful that there are going to be lots of changes, but I am hopeful that we can govern some of these changes more for the good than for the bad.
So Ilaria, one thing came out clearly, these live wild animal markets are very dangerous, and it's not the first time that somehow a virus is escaped from that environment. Do you think we will see a ban on wild animal markets?
Already there's information in that direction. There's actually, I read on the paper today that there's going to be a ban on the consumption of cat and dog meat, but it's not going to happen overnight. So it's good. I am very happy, but it's not going to happen overnight. I mean, culture is very difficult to change. So I think it's a step forward, even for conservation, because a lot of those animals are endangered species. So this is good, but it'll take time.
Ilaria, I can't thank you enough. Is there anything, how would you like to conclude this conversation? Because from my end, what I hear from you every time I read an interview or I see you on television, I'm always inspired by the depth of your knowledge. And I hope we will hear more and more people like you advising governments, because we need policies, and politics needs to be involved and needs to have an approach that's scientific based. But I'll leave the last word to you.
Well, Rula, I would like to thank you for this, and I would like to ask you to put at the end of this interview the link to the video Beautiful Science. Beautiful Science is a video that was developed by my center. It is an emotional and inspirational video about the beauty of science. The music is by Maestro Andrea Bocelli and Giorgia, and it is really about how passionate, how determined, and how inspired our scientists are. Scientists who work in laboratories and who work in research centers, they often feel dismissed by the public as if they weren't doing something important. You know, they are maybe, yeah, he's a scientist, he's a bit cuckoo, or yeah, but you know, he lives on the top of the mountain by himself. No, we are people like you. We are people who love our jobs. And we, as a community, we should be proud of our scientists.
Our scientists are essential. And for a
Yeah.
long time, the role model was a fashion influencer. It's time to go back to the essential, to the important. And moreover, you know, I cannot stress how much I admire Ilaria's work. Please follow her work, follow all of the initiatives. And wherever you are, if you can contribute, you're contributing to saving our lives, our planet, and elevating science. Thank you, Ilaria. Thank you so much. Grazie.
Thank you, Rula. Thank you.